Hello, living at your finest, champions. Good evening. Good evening. It is another Wellness Wednesday. I'm glad to be here. I hope you've had a great week. Yes, I know. Countdown to Thanksgiving. I know. It's a few days away. That's the reason why I decided that I was going to talk about how we can lower our sugar because we know that there's a lot of eating going on, a lot of high sugar content foods. And it is November, which is National Diabetes Awareness Month. So I'm glad that you're here with me. We're going to dive into what raises our sugar. Why is it even important that we must regulate our sugars? And what can we do to regulate our sugars naturally? Now, the reason why I'm passionate about this is because my husband and I really had to put our heads together and figure out how can we get him from just that one point away from being diabetic and not being going on medication to lifestyle changes that would regulate his sugars. So we were successful at doing so. And these are some of the things that we're going to share with you today. So definitely dear to my heart, we have a family history of diabetes and definitely wanted to make sure that we keep it under control. Now, as I mentioned, Thanksgiving is around the corner. I know it's going to be different this year. We definitely have to stay safe, right? We have to wear our masks, practice social distancing. I know it's a hassle, but it's better than the alternative, which is to be ill and in the hospital. So it's very important that we take advantage of this opportunity and figure out how can we enjoy family time in a safe way, as well as making sure that our immune system is well built. So that's what I'm going to be talking about today. But before I do that, let me introduce myself to you. I am Dr. Dolapo Babalola, aka Dr. Babs. I am a family physician and I'm the founder of Living at Your Finest Corporation. My passion is to apply a fun, fundamental, faith-based framework to help women to live at their finest holistic health without engaging in the complexities of the diet culture cycle. I share lessons learned from my personal health struggles as well as my extensive professional training so that women can possess their worth, nourish their spirit and their body, and become triumphant health champions. So that's my passion, and I'm really excited that I get to do this with you. So welcome again to Wednesday Wellness. Thanks for stopping by, and I want us to make this an engaging experience. So please leave comments, and if you haven't already signed, given StreamYard the permission for me to read your comments, please do so. That way, I can acknowledge your presence and I can respond to your questions live. So yeah, let's dive into this. Let's start talking about why it's so important. All right. So what we're going to talk about, as I mentioned, is foods that either increase or reduce blood glucose. And the reason why it's important, diabetes. We want to avoid diabetes altogether. And if you have diabetes, you want to keep it controlled so that you're not needing multiple medications. Diabetes is a condition that occurs when there's high sugar in the bloodstream. Now, sugar is how we get our energy, which is a good thing. But when we have excess amount, it's not a good thing because it circulates in the bloodstream. So anywhere there's blood, which is everywhere in the blood in the body, right? If there's sugar, it thickens up the blood, it causes damages all the way from the head to the toe. Just name it, it will cause damage. So we want to keep that sugar down. Now, what happens is that insulin is the vehicle that gets rid of the sugar in the bloodstream and takes it to the cell where it's needed for energy. But if the insulin is so overwhelmed, it's always present to get rid of sugar. And then there's all sorts of factors that prevent the insulin from working well, such as poor eating habits with fat and unhealthy food choices. It just prevents the insulin from working as well. And so that's where we hear of insulin resistance. But I have more information about the 411 of diabetes. So if you want to learn a little bit more about what type of diabetes, how to diagnose, how to treat, I do have a YouTube channel that I discuss the 411 of diabetes. But for the purpose of this session today that we're having the Wellness Wednesday. We're just diving into the foods that increase it and how we can naturally decrease. All right, so let's start off with what increases blood glucose. When I say glucose, I'm referring to sugar as well. Carbohydrate is the culprit. Now, carbohydrate has gotten a bad rap, but it really is not bad. We just need to figure out which kind of carbohydrate we need to eat and how to eat it. So you know me, I love my pictures, so I'm going to go ahead and share so that we can see what I'm talking about. All right, so carbohydrates. Okay, so this is where we talk about the different types. So we have the good carbohydrate and the bad carbohydrate, and that's what we need to be mindful of. Good carbohydrate is our complex carbohydrate, so it's high in fiber. A metabolism booster, it makes us feel fuller, it stays longer because it's fiber, you know. Good examples you see there: whole grain bread, brown rice, beans, nuts, seeds, oatmeal, fruit. Fruit, yes. Now, there are different fruits. There's some that are high in sugar content and will raise your sugar higher than others. So you need to be, especially if you're a diabetic patient, you need to be familiar with the portion and which fruit that you can actually eat. Sweet potato is definitely a good carbohydrate, better than the white potato, and veggies. Now, bad, which is a simple carbohydrates, are those that are so low in fiber that once you eat it, you get this big sugar, rush, and then it crashes right back right away. It has empty calories, it turns to fat, and you just feel completely tired. Food examples here will be white bread, sugar, all the candies, the cookies, all the things that we say we like so much, and I was addicted for so many years. I definitely have to make a conscious effort to avoid these because that's what spikes up our sugar. And these are the things that my husband and I had to purposely work on to decrease so that he could return to normal values, and I myself was not increasing my risk for diabetes. Another slide that I would like to share with you here is making sure that you know when I refer to glycemic index. I don't know if you've heard about this glycemic index. This just tells you how quick that food raises your sugar in your bloodstream. You see that the low GI means the gastrointestinal foods, they have a lower GI index, which is great because you don't want something to just turn very quickly into sugar and dump a whole bunch of sugar in your bloodstream. Pineapple is definitely one of those that have medium, so you have to be careful. And then you see that rice, white bread, mashed potatoes, they have a high glycemic index. That just means that as soon as you eat it, you are going to have a quick sugar rush. You're going to have that insulin, getting a call that there's so much sugar, you need to get rid of the sugar and take it to the cells where it's well needed. But if it's so overwhelmed, it wouldn't do the job as well as it needs to. And unfortunately, the excess sugar will convert to fat and store as fat. All right, so I guess enough said about carbohydrate. That is definitely one of the culprits for increasing our blood glucose. So if we differentiate between the simple and the simple and the complex, then we can make better choices. Now let's talk about what decreases our blood glucose. So there are several things, and these are all evidence-based, right? Evidence-based. We have a few things like healthy oils, what is considered healthy oils. I do have another YouTube channel, video rather, that talks about cholesterol, so high cholesterol, and I'll make sure I reference it so that you can watch and share with your friends and family so that we're all healthier together. So healthier oils would be things like olive oil, avocado oil. They don't convert so quickly. When you sit down to eat, make sure that your food is just not carbohydrate only, because again, as I said, that is just pure sugar. You always want to make sure that you have protein and you have to have a good fat, because that slows down how quick your food converts to sugar and overwhelms the insulin and it overwhelms your body overall. Cinnamon has been shown to be very, very beneficial in regulating the sugar. You sprinkle that in your food. I do that. I sprinkle it on my apples. Apple already has enough, a good amount of fiber, so it makes me full. So I'm not snacking on processed foods because that I'm going to get hungry and I'm just going to be eating the wrong things, and then my sugar is going to spike up high. Yes, so cinnamon sticks I have in my container here, water with some cinnamon sticks, and it just, you know, infuse my water, regulates my sugar, and same thing my husband did. Uh, let's see, what else? You can, there are some cinnamon teas if you like that. Several ways that you can use cinnamon. Now, apple cider vinegar. I'm sure you all heard about apple cider vinegar. My patient, one of my favorite patients, and all my patients are my favorite patients, but one in particular told me about apple cider vinegar, and oh my gosh, it's amazing. It has tons of good benefits. Particularly lowers your sugar. It lowers your sugar in the bloodstream. Evidence has shown that it does a good job with it. There's several other things that it does, but let me pull up a picture so that you can see. Uh, let's see all the benefits of apple cider vinegar. Yeah, look at that. So tons of benefits. So apple cider vinegar is just apple, right? Apple is great fruit with high fiber, low calories, has lots of nutrients that our body needs to stay strong and build our immune system, especially now that we're in COVID and it seems like we're getting into a second peak again. We all need to make sure that we're keeping ourselves healthy. And this is what I do. I don't take a shot of it because it can affect your teeth. You don't want to have damaged teeth. So I don't recommend that you drink it directly. I do recommend, though, that you can dilute it with lemon and water. That's what I do. And some people put honey. Again, if you already have diabetes, you do want to speak to your primary care provider to run this by them, because even though I'm giving general information, I am not your own physician, so I don't know your unique situation. But apple cider vinegar overall improves digestion, lowers blood sugar levels. And this significantly helped me and my husband. So if you haven't heard about apple cider vinegar and its benefits, you want to take advantage of it now. All right. And let's talk about the other walk. Oh my goodness. Walking, walking, walking. That has been proven that just walking, again, imagine the cells in your bloodstream, um, you know, trying to get sugar, and you just walk in right after a meal instead of sitting down and like, oh, I'm so full and stuff. When you walk, you actually help the insulin to, open the door, get the sugar from the bloodstream into the cells. Isn't that amazing? Even if it's just 15 minutes walk. And this is what my husband and I did. We decided after gaining so much weight during COVID, the beginning of COVID, we're like, okay, this something has to give. So we started walking, after meals, first thing in the morning, and it really did help. It makes that sugar come down significantly because you're helping to mobilize it. And let me show you, I'd like to show you a picture again. Let's see, about the benefits of walking. Yeah, look at that. It increases our energy. It lowers blood sugar. So please, if you didn't take anything at all from this talk, is make sure right after a meal, if it's your heaviest meal, just walk around the block. You don't have to go outside or go to a gym. Just walk around and get that sugar down. Especially now with Thanksgiving coming up. Not that I'm saying you should indulge, but again, if you do, don't just sludge on the couch and watch a movie. Just take a few blocks, walk around the block. It helps to boost your immune function, definitely helps burn calories, and it eases your joint pain. And this I found very beneficial because I was having a lot of joint problems. I have family history of arthritis, and again, being addicted to sugar until I started practicing mindful eating, did I start feeling that relief with just walking alone. Yeah, so let me show you a final picture about the top hacks, right? Just putting it all together. I like to summarize it so we see it all together. So the top 12 foods that balance blood sugar levels. Coconut has been shown to do so. Turmeric is a great anti-inflammatory. Cinnamon, I already spoke about cinnamon. Raw chocolate, organic coffee, green tea. I do a lot of green tea. Whenever I do my green tea, I actually add my apple cider vinegar in it as well. Lemons, great vitamin C, also helps to regulate our blood glucose. Avocado. Now, I'm not a big fan of avocado. It always leaves a really interesting taste. So I just do the oil, the avocado oil, because it doesn't have a taste. Olive oil, grass-fed butter, and pasture-raised eggs. So these are the ones that have been shown, the foods. So, figure out which one you want to adapt and see how it works for you. If you already have diabetes, the goal is to keep it controlled and not needing several more medications to keep it under control. Pay attention to the carbohydrates, what you're eating. Pay attention to the activities that you engage in after a meal. All of that together, it's a multifactorial process that will get that sugar under control and keep you from, even if you're not diabetic or you're pre-diabetic, will keep you from getting over that number. Yeah. So in summary, I always say this, that when diet is wrong, medicine is of no use. It's no use to use medicine if your diet is wrong. Who are you fooling, right? That's how I tell myself. But if your diet is correct, then there will be no need for medicine. And when I say diet, it's just pretty much what we're eating, how we're eating it. So definitely want us to enjoy the Thanksgiving break, but for us to be mindful of the complications that arise after poor eating. And if we do have to indulge, share the calories, do the things that I've said in terms of cinnamon, apple cider vinegar, going for a walk, all of that helps. So this helps to give a nice summary picture. And I think this is my last slide for this session. Yeah, so reverse diabetes immediately. Avoid carbohydrates that would raise blood glucose. I think that's what I made myself clear about. Consume sugarless coffee and tea. Now, if you wanted to use, a sweetener, stay away from artificial sweeteners such as Splendor, all those other ones. The best one really will be stevia because it's natural. Do more of stevia or monk, MONK. Those are better sweeteners. Stay away from Splendor, all those other ones. Definitely avoid added sugar, sweet drinks. Whenever it's better to have an orange than to drink a bunch of orange juice, because orange juice has tons of sugar in it. The orange itself has the fiber and it helps you, it doesn't crush you down, doesn't dump a whole bunch of sugar right away. I already spoke about the avocado, the almonds. Those are healthier oils that keep us full. And definitely want to go for high quality protein and fat in every single meal. Make sure whenever you're sitting down, if your food doesn't have protein and a good fat and some veggies, that food is not good. If you're just eating pancakes on its own, that's going to crash your sugar. And then last but not the least is what I talked about, going walking, exercise. That all helps to reduce your sugar and keep it regulated. All right, so looks like we're done here. Let me find out from you. How are you going to lower your blood sugar? What are you going to do? We've talked about a few things here. I'd like to hear from you. I'd like to, hear what methods you're going to use. We're healthier and stronger together when we learn from each other. So share in the comments. I'll see if I have any comments that I can respond to live. It does not appear so, but okay. Well, I'm glad to have had this conversation with you. It's just being empowered with information. We're informed, we become transformed, and we become triumphant at living at our finest health. It's something that we need and we deserve, and most certainly we can achieve it. So if you are watching on YouTube for additional educational resources, please do not forget to subscribe, hit the button so that you can get daily reminders once a video is released. Don't forget to share with friends and family so that we're healthier together. So until next time, I wish you all the best and happy Thanksgiving. Yay!